short term, and they can cause problems in the long term.
Oh.
So I'd encourage you to kind of give it a few days, and if the tiredness gets worse and worse, then maybe we'll need to return to those steroids for a little while. But if it levels out and then starts to get better, because usually the first couple days after you finish, you just
That's what
you
I
miss
figured
it.
too.
So give it a few days.
Okay.
If things turn around and you feel better, you will benefit from not being on the steroids.
That's what I figured.
If we give it a few days and things just get a little bit worse, then maybe you need to be back on them for now. And we can always start them back, but we need to keep, even if we end up restarting them back, we keep revisiting this and trying to take you off of them. And the reason is there are consequences to being on them too long.
Okay.
They can irritate the lining of the stomach, causing heartburn. They can cause weakness in the muscles closer to your body. So getting up out of chairs, doing stairs, getting in and out of cars, that can get difficult. It can cause puffiness in the face. It can move your blood sugars high. It can give you trouble sleeping, make you feel jittery, play with emotions. So lots of things that they don't do that to everyone, but those are all possible things that can happen if you keep the steroids on longer. And so if we can get away with having you off of them, that's the better thing to do. But if we need to return to them, we will.
Now, is it best for her to keep a record of this daily? So we
How
don't
you
have to
feel.
remember and,
Oh, well, I always have a list, everything is okay. I
Yeah.
always keep track of
so
everything.
it'd be best
Yeah.
to keep track so that way she has the accurate information
I
for
do.
you.
So basically, the things we're looking out for, profound tiredness and worsening of any of your symptoms. So headaches showing up, worsening weakness on the left side, if a seizure showed up, if any of those things happening would be indications that maybe we need to return to the steroids.
Okay.
Very good.
With the radiation, based on the fact that I do still see some tumor there after the surgery, they got a lot of it out, but there's a little bit left. I would favor giving you the standard 6-week course of radiation rather than trying to compress it down. I think you've already talked with medical oncology about, with Dr. Cherry, about doing the temozolomide. The radiation that I would give you, like I said, would focus on the tumor in the area around it. To give you that treatment, we have to set you up lying on your back, and we have to do 30 of these treatments. So we have to get you in that position over and over again. To do that, we make a mask for you. It's a plastic mesh, so you can see it and breathe through it. While you're lying down, we put the plastic mesh in some warm water. It gets soft, and we stretch it over your head and your neck. Then it hardens up. And then we take a CAT scan with that mesh on. This CAT scan is not to find anything new. This is to get pictures of you in the position that we're going to treat you in.
Okay.
And then we fuse that together with that MRI that you had right after your surgery. And we use that to design on a computer a plan to treat that area of the brain. It takes us about a week to do that.
Okay.
And once we have the plan ready, we get the treatment started. So the first treatment takes 30, maybe 45 minutes because we have lots of checking to do. And the rest of the treatments take 20-ish minutes. Most of that time is being set up. So we bring you in, we position you on the table, we put the mask on, we take some images to make sure everything is lining up the way it's supposed to, and then we give you the treatment. So the actual getting radiation only takes a few minutes each day. These are x-rays, so you don't feel anything when you're getting these, just like you don't feel anything when you're getting a CAT scan or a chest x-ray, unless they give you dye, which we don't. So the main side effects of this tend to be some tiredness, some patchy hair loss in a strange pattern, because we're going to have beams coming in from lots of different directions. So parts of your hair will fall out and parts of it won't. And it'll take about 3 months and then it'll start to come back.
Oh, okay.
Your scalp will be sensitive to sunlight for several months, so you'll want to wear a hat if you're outside for any amount of time. The other side effects are basically potential side effects of swelling in the brain, because sometimes with the radiation you can get some swelling, so headaches, nausea, vomiting, seizures, worsening of your symptoms of weakness on the left side, and those might be reasons we might need to return you to steroids. So sometimes we end up having to restart the steroids during radiation just because you're having some temporary swelling due to the treatment. When we treat with radiation in the brain, there's always a chance of causing damage to things in the brain. And so in this particular area, we could cause potential effects on vision, which is unlikely. We could cause more weakness on your left side. It's less likely to cause trouble with speech and memory because we're over on the other side of the brain. That is a possible side effect, but that's less of a concern than if we were treating over on the left side. So those are the main things. And then after the radiation, it's possible to have what's called radiation necrosis, which is damage to the brain tissue from having had radiation. And if that happens, again, it can cause these similar symptoms. And that can happen, weeks or months after the radiation is done.
It happens shortly after.
No, sometimes it happens quite a while after.
Okay.
So that's not terribly likely, but that's possible. So that's what the radiation would be all about. And then we would follow afterwards with MRI scans. We would do the first MRI scan after the radiation is done, and that's kind of the new baseline. You're not going to see much of a change because changes in brain tumors many times happen slowly over months. So that first scan after radiation mostly looks like you just got radiation, but we need a new baseline so that when we're taking a look at your brain during the temozolomide after the radiation, we know if things are getting better or worse since the end of the radiation. So,
And how often do you do those MRIs or
usually at least every 3 months.
Every 3 months.
Sometimes more frequently depending on symptoms.
Okay.
Okay.
Mhm.
Sounds good.
Yeah.
And we're going up to Dr. Rowdy the 20th
Okay,
for a checkup.
Next Tuesday.
all right. Any questions for me?
No, I don't have any.
No? Sounds very good.
So are you interested in moving forward with the radiation?
Whatever it needs.
Yes.
Whatever she
Okay.
says, I'm happy to do whatever.
Okay, so we'll get a consent form taken care of today, and then we'll schedule you for that planning session to happen in the near future so we can get that on the road, probably targeting starting your radiation the week after next.
Okay.
Because we're going to get the planning session done, and then we're going to need to do the plan. And I think still next week, it's slightly inconvenient, I do apologize. We bring you here to make the mask, and then we have to take a field trip up to the hospital to do the CAT scan. We've put a new scanner in this department, but they're still calibrating it, so
Right.
I don't think we can use it for patients yet.
Mhm.
It may be online as soon as next week, so depending on when your scan is, you may be one of our first folks on the new scanner, or you may have to take a field trip over to the hospital. But
Okay.
the scanners should be pretty, our scanner's 1 year newer than theirs, so, but they're both really good scanners, so it's just more convenient to have it here.
Oh,
It's just,
sure.
we replaced our previous scanner with a new one that has new features.
Sounds like you got some updated equipment.
Yes, our treatment machine is also brand new. Just started treating patients on it in December.
It's great.
And whatever she would like, through you, I'd like, both of you
Certainly.
to communicate.
Yeah.
Yeah.
She does what's best, and you do what's best. So.
But you being the patient, we're going to loop you in on this too.
Yeah. We are going to include you.
And yeah, and Dad's a kidder, so if he will. Okay.
So I apologize. The knock on the door means that they need me to step out and check a film for a patient,
Oh.
so they can start their treatment. I'm going to step out and do that, and then I'll bring back that consent form. And